morning, Mrs. Belena. How are you today? Okay, that's good. Did you sleep well? Alright. Just here to check your prescription. I want to see what the doctor has ordered for you. Okay, so the first thing that I need to do is I need to make sure that the prescription I have in front of me is for my patient specifically. So I've already greeted Mrs. Belena and she responded, which means that it is her name, but I have to be sure. So I have to look at the details that are on the prescription chart and I have to verify that with her ID band. So let's see what is on the ID band of Mrs. Belena. Ms. Belena, do you mind? Thank you. So here's her ID band, and it's indeed Ms. Belena Tate with a GT number of GT01005505 in Ward 196. So we have the right patient. Thank you, Mrs. Belena. Okay, so now that I'm sure that this prescription is specifically for Mrs. Belena, I need to look at 5 things. So there are 5 rights to verify a patient's prescription. We need to have the right patient, we need to have the right drug, the right dose, the right frequency, and the right route. Okay, so I've already looked at the first one, which is the right patient. I've already established that we do have the right patient. So now we need to have the right drug. So if you look here on Mrs. Belena's prescription, the doctor has prescribed her Norflex 60 milligrams in 2 ml of saline intramuscularly BD. Okay, so we have the name of the drug, it is Norflex. And then we also have the dose, 60 milligrams. 60 milligrams, the frequency is BD, we have it. And we also have the route, intramuscularly. And we also know when this medication was prescribed. It was prescribed on the 29th of the 4th of the 16th. And we need to have the doctor's name. We need to have the doctor's qualification and signature. So this was prescribed by Dr. Sibanda. He has a MBBCHB and we have his signature as well. Okay, so in order to further determine why this patient is prescribed this medication, I need to know my patient's condition. So what is Norflex? Norflex is a muscle relaxant. And so Mrs. Belena Tate has been prescribed this medication because she has problems with her central nervous system. She's been having muscle twitches. So what Norflex does is it relaxes her muscles. So that's why she's getting this drug, Norflex. And then, Mrs. Belena, some of the side effects that you may experience due to this drug, Norflex, you may have a dry mouth, you may have headaches, or you may feel dizzy. But if you start experiencing any of those symptoms, please be sure to report. Right? Okay, thank you. So I verified Mrs. Belena Tate's prescription. Now, what I need to do is I need to go to the dressing room. I need to prepare all of the equipment that I'll need to give her this intramuscular injection. And then once I've done all of that, I'll come back and I'll administer the medication.